From expectations to conversations, we offer all the services you would expect. HealthFirst Network provides quality, confidential reproductive health care, education, and nutrition counseling.
Jesse Scharfenberg, CEO of HealthFirst Network, talking about how reproductive health affects other areas of health, and why is HealthFirst Network essential?
We provide reproductive health care, and there's many people that would probably argue that reproductive health care isn't essential, but your whole body is connected from head to toe, so each system is so important.
I have to jump in and ask this. How can it not be essential? I thought I heard a lot of the bigger hospitals and stuff are kind of turning people away from, testing and birth control and seeing patients. And when you're at home alone, I'm just going to say that. What are you doing?
Right. And that's really interesting. We've heard that and we've seen clients. We've actually had an increase in client caseload right now during the COVID pandemic because individuals aren't being seen at health systems for reproductive health care because there was certain subsets of services at health systems that were deemed non-essential. And when I heard this and I was thinking, I'm like, how is reproductive health care non-essential? It is such an essential part of your body. It controls pregnancy. It controls STIs. There's UTIs.
So as somebody that's listening doesn't know what STI and UTI and STD and all this stuff, what does that stuff mean?
Sorry, I like to use alphabet soup a lot. So thanks for calling me out on that. STDs were sexually transmitted diseases. And then back in 2015, 2016 timeframe, the Center for Disease Control and Prevention changed it to STI, which is a sexually transmitted infection.
So they're the same?
They're the same thing.
Okay.
So STD, STI is definitely interchangeable. We try to go with the new nomenclature of the STI so that we are in line with what the Centers for Disease Control and Prevention are utilizing. UTI is a urinary tract infection. So a lot of individuals may confuse that they have an STI, but it could be a UTI, or someone may think they have a UTI and it's actually an STI. So bringing those individuals in for testing and treatment is super, super important. So infections can travel. So it's really important that we are having and performing STI testing on a normal basis. One of the big things that we do is screenings for cancer at HealthFirst. When you're thinking about breast cancer, we do clinical breast exams all the time. We're sometimes the first line of defense of identifying some sort of nodule that we're going to refer an individual out for mammogram. We do paps and pelvics. After a pap smear, an individual may have been identified that they have cancerous cells. One of the next things that we can do here is actually doing cervical biopsy to identify what's going on and then referring an individual out. It's really unfortunate that individuals wouldn't think reproductive health is essential and that education around reproductive health is not essential because a lot of these things that we see, we could prevent. There's so many STIs that could be prevented if an individual just knew how to prevent it. So let's use a condom and let's practice safe sex. We offer the HPV vaccine, which is human papilloma virus. That's something that's been controversial for the past 10 years. I don't understand why, because it's the only vaccine out there that prevents cancer. And at that, it prevents 9 strains of the most common cancer-causing strains of HPV cancer.
And that's given to both boys and girls,
It's given to both boys and girls, and which was really, really cool. Last year, we actually changed the age range. So it used to be 11 to 26-year-olds. Now 27 to 45-year-olds can receive the vaccine as well. So we're going to continue to prevent cancer in individuals who are already sexually active as well.
How can that be non-essential?
I don't know. It was really interesting when this came out. There was a lot of reproductive health clinics that kind of put services just on hold. I took an initiative and worked with the University of Wisconsin Collaborative for Reproductive Health, the Wisconsin Contraceptive Access Network, and then the Wisconsin Family Planning Reproductive Health Association, which I serve as president for, and said, hey, we need to put something out there to let individuals know that reproductive health care is an essential service. Individuals should have the choice of when they want to become pregnant. They should have the choice to go in for STI testing if they are sexually active. We know during this time frame, individuals are not ceasing sexual activities. So let's give them the tools to do it safely, whether that be condoms, whether that be education, or let them choose when they want to become pregnant by letting them properly space pregnancies or just prevent pregnancy with a contraceptive method. One of the things that kind of has this big black cloud over it is the word abortion. Abortion is not something we do at HealthFirst. My personal mission is that an individual should never be in the position to have to make the choice as to whether they have an abortion or not, because we should be preventing every single pregnancy that wants to be prevented.
What about education? Having conversation with your staff over the last few hours today, I mean, I've learned quite a bit. Do you offer educational services?
We do. We actually have quite a few different educational services, and we continue to look at expanding those. We go into schools and give many presentations around pregnancy prevention, contraception, and then STI prevention, so that individuals know what STIs are. They know that if you're going to be sexually active, you may become pregnant, and how do you prevent that? We give community presentations. We've instituted a really awesome curriculum in the Adams Friendship School District. It's called TOP. It's a teen outreach program, and it's really about building self-esteem and then talking about sexual health on top of that. So we want to get them a good base at the 6th grade level to hopefully prevent some of those unintended pregnancies and STI rates that we are seeing in Adams. So we provide a lot of education around that. We have individuals that just come in for education. They may not be coming in at all for reproductive hands-on services, but just education. We have another really cool partnership down in Adams Friendship. It's called the Diversion Program. So we know that individuals, once they are in the juvenile justice system, they're more likely to be repeat offenders and continue to have charges that become worse and worse and worse. So our goal is to keep individuals out of the juvenile justice system. And in that county, we were seeing a lot of young individuals being referred over to the DA for consensual sex acts. So maybe it was two 15-year-olds having sex. Maybe they were sexting pictures to each other. Our goal is, whether it be the district attorney, social services, the school, or a local police department, identifies that, and they actually refer the individual over to us for consequence education. So we're taking an educational route versus a prosecution route with those individuals. And we have the school, Health and Human Services, the local sheriff's department, local police department, the DA, everybody's involved. And what we do is this huge prevention aspect of, we have these kiddos, they're identified, we go over education with them once they're referred to us. We have the local women's shelter come in and provide healthy relationship education. And then when that charge actually goes across the DA's desk, the DA can see that they actually went through the educational session and most likely aren't going to pursue charges to put them into the juvenile justice system.
For more information, visit www.healthfirstnetwork.org or find us on social media at HealthFirst Network, Inc.